Yeah, I just think that human beings deserve to be summed up in more than just a few words. And I think that there's issues to do with the scientific validity of certain diagnoses, and that's certainly something that's very much discussed at the moment amongst psychiatrists and psychologists. Not that they agree on it necessarily. And I think that we can give far more detailed and nuanced explanations of people's behaviour.
So everybody, welcome to Psych for Sore Minds. I've got a very special guest today, Kerry Daynes, who is a criminal psychologist. She's also a TV personality and an author of a couple of books, one of which we will talk about a bit later on, which is called What Lies Beneath. Hello, Kerry. How are you doing?
Hello, and just on cue, my dog starts to bark. Can you imagine? Yeah, typical.
He's obviously bigging you up as well.
I know, he's got a tripe stick and he's barking at that, so I'm going to take it away from him. I don't know whether you want to do that again or not. I was just going to miss timing for the dog.
No, it's all good. It's all good. Let's keep it natural. So, Kerry, if you don't mind, I'd like to start off with a story about a patient, because I think it's always good to whet the viewer's appetites. So my first question would be, you can choose any kind of case that sticks with you, either because it's emotionally charged or just interesting. What kind of case sticks in your mind?
Oh God, so many cases stick in my mind, which is why I wrote my books, I suppose. But off the top of my head, some of them make me angry because of what somebody has done, of course. But more often than not, I get very angry at the way that the system treats people and the way that we misdiagnose people, or we just misunderstand people. And there's a story in my first book about a guy that I've called Gary. And Gary was never without his orange bag, his bag for life. You've probably seen similar ones with the elephants on them. And it said, "I'm strong and sturdy" on it. And he took it very literally that this was his bag for life and he hated to be separated from it.
Yeah.
So you can imagine the state that it came to be. And he was in prison and he had committed a sexual offence, a sexual assault of a 13-year-old girl on the back of a bus, whilst there'd been a bit of a fracas between him and a group of teenagers. So not the most, not the type of crime that you would expect a great deal of sympathy for. And he was an IPP prisoner, which means that he had a very short tariff of a couple of years, but he could be held indefinitely. Now, actually, IPP sentences have been scrapped now. But he was, I think, originally sentenced to, 2 or 3 years, and he was still in prison many, many years after the end of his tariff. And his behaviour in prison was causing a lot of problems. And I rarely saw Gary without a black eye or a bloodied lip, because he was constantly getting into fights with other inmates. And he was doing things that it's not wise to do in a prison. So you can imagine he was mooning. Which sounds silly, doesn't it? It sounds so juvenile. But if you're doing that, and if you're grabbing food from other people's trays at lunchtime, you are going to get yourself in bother, particularly if you are a sex offender. And he was constantly being beaten up, frankly.
Yeah.
And to cut a long story short, he couldn't progress. He couldn't progress to the point at which he would be considered no longer a risk. And everybody talked about how dreadful his behaviour was and how he had all of these behavioural difficulties. And I was asked to come and assess him really as a last resort, to suggest, what can we do with this problem prisoner?
Yeah.
Well, this problem prisoner, it turned out, had a really massive brain tumour.
Wow. And
his behaviour, this disinhibited behaviour, was to do with the impact of that on him. And actually, his offending in the first place might well have had something to do with that. I don't know, who can say? And so it became apparent that not only did he have this brain tumour, but it needed to be operated on pretty damn quick.
Yeah.
And Gary didn't make the operation. He survived for a few weeks afterwards, but died of complications afterwards. Oh, wow. So literally, his sentence, like his bag for life, was for life, and he was so misunderstood and so tortured, I think, in prison. And he was set all of these targets and hoops to jump through that he just couldn't possibly jump through for many different reasons.
Yeah.
And it stuck with me as a really tragic case. And whenever I am in a high street, you invariably see, don't you, the orange bag for life, I'm strong and sturdy. And it just always reminds me of Gary.
Okay. So when you talk about Gary, the first thing that strikes me is it must be quite hard to diagnose that, right? Because there has to be neurological signs for a brain tumour, and ideally you need obviously like a CT scan. So how did you manage to navigate around that in a prison environment?
Well, there were lots of issues to do with his behaviour which were pointing towards a problem. And it was the obvious thing, but that just doesn't happen in prison settings very often. I tracked down his medical records. Right. And I really did do a little bit of detective work, and he was known to have had a brain tumour, and it was known to be at the point at which it needed to be operated on, at the point that he went into prison. And yet this bit of information, this crucial bit of information, got completely lost. And because he had mild learning disabilities, and because he had the problems that he had, he didn't offer up that information. And so it really was a case of getting him to consent to me having his medical records, and then going on a long, arduous journey to track them down and find them. And this is it. Often the information is there. It exists. Yeah. It's just that we don't bother to look for it. And incomplete information travels with people from place to place. And this can be the ultimate price that a patient can pay for it.
Absolutely. So I completely relate to that. I think medical records going missing or not being available is a bane of the whole world of forensic psychiatry and psychology, and especially in the prison system, that just communication always seems so lax. Okay, so people have already heard about one of your cases. Do you mind please telling us, Kerry, for those that don't know, what your role actually involves? So I'm a forensic psychiatrist, you're a forensic psychologist. There's obviously a big overlap.
I'm not a criminal psychologist, because that makes me sound like I'm a psychologist who's slightly dodgy and possibly on the mafia payroll. So I'm not doing anything criminal, but yes, I am a forensic psychologist, and I've been lucky or haphazard enough to work in secure hospitals, in prisons. I've worked privately for the police, so I get involved in police investigations. So I'm very general in that respect, but I think that I've specialised more in crime, what we would term mentally disordered offenders. Yeah. But I also have a sideline in police investigations and police interrogations, or rather police conversations, as I like to call them. Okay. So I've had a pretty varied career, really.
Yeah, absolutely. It sounds like you've kind of orchestrated it so that you get a lot of variety and you get to see a lot of different angles.
I think I've got just a very short attention span, but it's nice to work in different settings, really, and get a feel for them.
So a lot of people watching this might have aspirations to become a forensic psychologist such as yourself. Do you mind telling us what's your favourite aspects of your jobs and what are the most frustrating aspects?
Oh gosh, the favourite aspects of my job, I think, are meeting people, because I genuinely like people. I think that if you don't like people, don't go into forensic psychology, because you really won't last. You have to genuinely, care about human beings. And you'd be surprised, actually, because a lot of people that I've met who do go into this profession don't necessarily have that caring side to their nature. And meeting people and hearing their stories, understanding their stories, and being able to intervene in a way that is useful. There's nothing better than waving somebody off at the door of a hospital and knowing that they are going back to their lives, or they're going back to a better life, ideally, and you're not going to see them again. I always say, with the best will in the world, I just don't want to see you ever again. I think that the frustrating aspects are, oh gosh, how long have you got? It's the red tape, the bureaucracy, the nonsense laws and rules, and being asked to make recommendations for intervention for people when those interventions are not available, we don't have the money for them, they're not going to happen. So seeing people get stuck in the system, which I see over and over again, drives me to distraction. And it's really, I think, why I've stepped back from it. Not completely. I'm still doing parole board reports. I'm still working privately. I still work with the police. But I've given up the 9 to 5 of hospital work.
Yeah.
And now choose to write about it because I feel that I can make more of a difference that way.
Yeah, absolutely. And I want to ask you about your book in a couple of minutes. Just going back to something that you were saying, when you get to say goodbye to patients and you see them go off and hopefully live fulfilling lives, I would argue that what we do is quite unique in that there's the job satisfaction, or at least the feedback, is minimal compared to most areas of psychology or of medicine. So we don't really get to see patients get better usually. And when we're involved in their rehabilitation, like in secure units, almost all the time they don't want to be there. They're sectioned, against their will, sometimes for months or for years.
Why would they? Who would want to be in that environment, to be honest? I mean, you know how it feels to be desperate to go home at 5 o'clock or 10 o'clock, depending on what's going on that day. And, imagine if you were there permanently and you didn't have the choice to leave.
Absolutely. So I think we're a bit like the taxman or like parking attendants, in that we do a job that has to be done, but the people that we work directly with probably don't really probably not grateful to be in that situation. Let's put it that way. Does that bother you at all?
Be in that situation, but having said that, I think that often they are grateful for the report that you write, or the work that you do, the therapy work that you do. And I've had a lot of people then go off and try and make contact via Facebook, which of course isn't appropriate. You can't be Facebook friends with your ex-client. Yeah. But I do occasionally get messages. Now that I'm more in the public eye, I get public messages saying, thanks, I'm doing well, etc., etc. Or you hear through the grapevine that people are doing well. But of course, there are people who think of you as, well, the last person on earth that they would like to see.
Yeah.
And, I write some pretty stinking reports for people because it's necessary. Risk assessment reports don't always say what people want them to say.
Yeah.
So for some people, I suppose I'm the devil incarnate, but I can live with that.
I think possibly it's marginally worse for forensic psychiatrists because we're sort of directly the ones that have sectioned them often, and we get to have the final sign off on discharge. And obviously we get the opinions of the MDT, and also a lot of patients don't want to be on medication, or especially on higher doses of medication, so they see us as the person whose fault it is, really.
And I can understand that as well. And I do think that I'm not sure about you, obviously, but I just think generally in psychiatry there's a lack of empathy for that, and the real power difference that exists between psychiatrist and patient. Yeah. You make decisions about people's lives often when they're not in the room. And I think that we often pathologize people's responses to that, because if somebody was doing that to me, I would be pretty pissed off. So I might get angry and I might have something to say, or I might be resistant. So, we put people down as treatment resistant or non-compliant when actually they're reacting in just a very human way to having a great deal of power and control taken away from them. I mean, I do think that psychiatric services can be really quite re-traumatizing for a lot of people.
And I also think that the tone of the message means a lot. So, for example, if you have to medicate somebody with like a powerful antipsychotic, there's a nice way of going about it. You can make them part of the discussion. You can tell them in advance about side effects, etc., etc. And you'd think that would be fairly basic and bread and butter. But I've seen many colleagues that do that well, but I've also seen many more that don't even seem to consider the patient's perspective.
Yeah, me too, absolutely. And I think that, one of my bugbears about psychiatry really is that there's an over-reliance on this biological model. and we forget to look at all of the psychological, social issues and trauma issues and issues of adversity, etc., etc., etc. So, but I think it varies between professionals and between MDTs. And as you say, sometimes you see it done really, really well. And other times you see very, very busy psychiatrists, and I can understand the pressures on that person who's literally got 5 minutes for somebody to make life-changing decisions about their care, and that lack of time for somebody, I think I struggle with often.
And thinking about it, it's not something we're really trained to do properly. Like for all the exams and all the side effect lists and chemicals that we have to memorize, nobody really sits down with you and says, this is how you should speak to a patient. The only way you really learn is by watching other colleagues, other MDT members, psychologists, consultants, and you choose who you emulate.
Yeah, and I think also that wherever you work, a certain kind of culture develops.
Yeah.
And often I've seen that culture become something really very, I hate to use the word toxic because it's overused, isn't it, these days? But yeah, toxic and unpleasant. And then in other places, it's done so well. So I think that more really needs to be done to think about that culture from the perspective of the service user.
So how do you do that, Kerry? What's the solution? How do you change the culture in a place?
It's very well. This is it. This is the big question, isn't it? I think that you've got to be the change. So you've got to lead by example.
Yeah.
I think that you've got to call it out when you see people that are doing things that are, unpleasant, and that's difficult because you want to support your colleagues, and there's a way to go about it. But sometimes you just have to call out bad practice. You really do. And challenge people. So I think a lot of it happens in supervision, and I think that a lot of it happens in management teams. It's for the management teams to filter down that culture. And I think that too often we're thinking about audits, aren't we, and meeting this target and that target, and making sure that this piece of paperwork is filled out. And actually, we lose the human side of what we do. And we forget to actually input into human connections. And I've seen that happen so many times.
Yeah, I absolutely agree. It is something we should call out, but it's difficult to get the tone right, isn't it? Because you don't want to appear really critical, especially if you're coming into a new sort of work environment.
Yeah, no, it is. It's really difficult.
I think your dog agrees with me.
Oh, there's my dog again. You know what? This happens every time I want to be on the phone. Every time I'm going to pick him up and show him to you.
I think he's jealous for the attention that you're getting.
I think it's my other dog has got a toy that he wants. So this is Captain Fur Potato, the pain in the neck whenever there's a podcast being made.
Captain Blue Potato, did you say?
No, Captain Fur Potato.
Captain Fur Potato, that makes more sense. Yeah.
Because as you can see, you've got a Rod Stewart haircut here. It's got rather a lot of fur.
Are you sure that's not an Ewok?
It looks like an Ewok, doesn't it? He really does. Yeah, no, he's a Pekingese. He's a Pekingese who's had minor surgery to his face to help him to breathe better.
Okay. Oh, I feel bad about about my comment.
Yeah, come May the 5th. May the 5th, he will be an Ewok. I can promise you that.
Kerry, you've mentioned your book briefly. Can you tell us a bit more about it, please? So tell us what we can expect if we buy it and why we should buy it.
Right, well, buy it if you want to. It's actually 2 books. So I'm going to do a quick plug here. So my first book is The Dark Side of the Mind. The second book is What Lies Buried. As you can see, I didn't get a head on the cover of The Dark Side of the Mind, but they gave me a head on the second book. So I see that as progress. I have a bee in my bonnet about the way that forensic psychology is portrayed on TV, and not only in crime drama and crime fiction, but also to some extent in the true crime domain as well. So we're viewed as these almost psychically gifted people who trample all over crime scenes. And, people really don't understand what the day-to-day life of a forensic psychologist is like and what it's all about. It's not all serial killers. It's everything, from shoplifters to stressed out parents to, you name it. So I wanted to write a book that was just the reality of being a forensic psychologist.
Yeah.
No sensationalism, but also I think to tell my story and how I've started to think differently about crime, criminals, and about the institutions in which I've been working. So the first book was, definitely a lot about me. It's a memoir. There's been a few reviews on Amazon that said, this girl talks an awful lot about herself in this memoir. Well, that's because that's kind of the point of it. So I talk about my journey through forensic psychology and some of the conflicts and the dilemmas that I've had.
Yeah.
And how it's changed my thinking. And then the second book, What Lies Buried, I think concentrates a bit more on the case studies. And I really want people to step into my world, see what I see, hear what I hear, and see whether, as a result, their views are challenged and whether their attitudes actually change as a result of hearing about the stories of the people that I work with.
Yeah.
So it's not just about hearing about them in the news and hearing about terrible things that somebody might have done. It's about trying to get a real 360-degree view of who that person is and how they got to the point that they got to and how we as a society view them and deal with that.
Okay. Yeah, that's very interesting. I can relate to a lot of what you're saying. So particularly that there seems to be this lust to hear about the gory details of serial killers or terrorists. So when I do interviews, that's one of the questions I get asked all the time.
That's what I get all the time. And I have actually worked with serial killers, but the number of serial killers, happily, that exist within our system are pretty few when you compare it to all of the other type of people that you might meet. But that's what people want to talk to me about, or they want to talk to me about ridiculous things. What do you wear to work as a woman? This kind of thing. How does it affect your sex life? I'm sure you don't get asked those questions.
No, not yet.
It's quite a bizarre thing, really. But yeah, there's this real, as you say, lust for what I describe as crime porn.
Yeah.
So this is not crime porn.
Yeah.
And also, I think that there's a proliferation of what I call, and this is a scientific term, pseudoscientific bollocks. There's an awful lot of that, I think, in the true crime genre.
Yeah.
From people who either profess to be experts and actually aren't experts. So, the TV and media psychologists that maybe aren't even psychologists at all.
Yeah.
But also, I think, from a number of criminologists also, who, again, I think are happy to package themselves in this very media-ready way, give the public what they want, but actually don't really tell the truth about how it is.
Yeah.
So very much I wanted to write something which was a no bullshit zone. And I sat down and what I had in my mind is, how would I tell these stories if I were telling them to a trusted friend?
Yeah.
So it's literally how I would sit. It's as though you were, sitting at my dining room table and we're having a conversation, really, albeit a rather one-sided conversation, admittedly.
I suppose part of the problem is that terms like criminologist can be quite vague. So that can cover a range of people some of whom might have frontline experience like you and I do, or it could be anyone that just has a vague interest in crime. And I suppose the average person doesn't know the difference between a psychologist and a psychiatrist, so let alone...
Exactly. And if they hear that somebody's a psychologist, then they assume, don't they, that they have certain qualifications. And actually, it's not a legally protected title. So that's not necessarily the case.
Yeah.
So, yeah, I think there's an awful lot of... there's good stuff and there's bad stuff out there, and it's difficult for people to be able to actually weed out the, which is which.
Absolutely, yeah. And I think there's a tendency for some criminologists, especially on TV, to not really give any kind of information. So they will, like, an interviewer will ask a question about a perpetrator, and they'll basically give the same amount of information as the question contains, but just wrap it up in fancy words.
Yeah, which is the pseudo
bollocks,
psychological bollocks, isn't it? Absolutely, or pseudo scientific bollocks. there's a brilliant scene in True Detective, which I appreciate obviously is fiction, where you've got a corpse, of course a beautiful woman, because it's always a beautiful woman, isn't it?
Yeah.
And she's mysteriously tied to a tree with stag antlers on her head, so she's clearly been killed in a very interesting way. You know, they're having a cigarette over the crime scene, which for a start you just think, you know, oh my God, this is ridiculous. The crime scene's open to the elements. And one of them turns to the other and says, well, her body is a paraphilic love map. And you think, what the hell does this mean? And I think that the dodgy experts on TV will often just pull out a diagnosis and they'll explain, oh, well, this person did this because they're a psychopath. You know, You know, it's one of the most overused terms. And people go, yes, that explains it all. And actually, it explains nothing. Yeah. And I think that we are far too reductive. We are far too reliant on labels, and they're trotted out constantly as though they are explanations. And, you know, it's simplistic and it's lazy. And it kind of gets my goat, to be honest. So I want to be the antidote to that, I think, if I can be. Or I certainly want to challenge it.
Okay, and that's kind of a theme that runs through both of your books, really, isn't it? Explaining or understanding the backgrounds and the traumas that the perpetrators have suffered.
Yeah, I just think that human beings deserve to be summed up in more than just a few words. And I think that there's issues to do with the scientific validity of certain diagnoses, and you know that's certainly something that's very much discussed at the moment amongst psychiatrists and psychologists. Not that they agree on it necessarily. And I think that, you know, we can give far more detailed and nuanced explanations of people's behaviour. And I think that where behaviour is extreme, we need to do that because we really risk stigmatising people that have mental health problems.
Yeah, absolutely.
And that's one of my concerns, and certainly something that I felt really quite anxious about when I started writing my first book, because I knew that I was going to be talking about people who do have mental health difficulties, although not everybody in my book has got mental health difficulties. Yeah. They've all got psychological difficulties, but I wouldn't necessarily class them as mental health difficulties or social difficulties. And I just didn't want to add to that, you know, that already existing stigma, really.
Absolutely.
I'm throwing toys. You can't see, I'm off screen. I'm throwing toys at my dog to try and stop him from barking.
So I just want to say to the viewers of this that I've read both of Kerry's books, and I found them absolutely fascinating. I think a lot of the stories just rang true for me because I've been in that situation and sat across from people and I had similar thoughts to what you've had, actually.
I was very brutally honest when I came to writing the books. So probably I think that my editor thought that I was ill-advisedly so to start with. It's like, really, do you want to say this? Do you want to be this honest? But I think for people to get the real story and the real experience, then you've got to lay it out there, really.
And was your experience of writing the second book much different to the first? Like, did you find it easier, quicker, for example?
Yeah, I think there was a lot in the first book that was actually very personal to me. And so I think the first book was almost a therapeutic process. It was almost a cathartic process for me. And I admit that I cried over a lot of it. I really did. And also, it's the first time that I'd ever written a book. I'm very used to writing reports, but it's a different experience. And my hair was literally falling out because I did this within the space of a few months. So add together deadlines and really very emotive subjects and a real kind of, you know, a space for me to think about my profession and whether my profession is effective and whether my profession is doing more harm than good. Yeah. You know, it was all really heavy stuff in a way, even though there's a lot of humour in the books. So the second book I found a lot easier. I think it was just a lot less personal, and I think that it was, you know, I'd kind of done I'd done the big emotional reaction to writing all of that down. So I laughed at my own jokes a lot more in the second book.
So do you think it's only because the second book's less sort of personal autobiographical, or do you think you got used to the process itself and managed to sort of streamline it?
I think a little bit of both. I think a little bit of both, definitely. And obviously, when you first write a book as a psychologist, well, I say obviously, it might not be obvious at all, but for me, I was thinking, my peers are going to read this. Well, maybe they're going to read it. Maybe nobody will read it. I don't know. Are they going to like what I'm saying? Are they going to slate me for it? Am I going to am I ever going to work ever again after I say these things? And so there's a whole load of anxieties that it threw up for me. And eventually I just had to think to myself, you know what? Write it as though nobody's going to read it. As I say, be brutally, brutally honest. And if people like it, they like it. And if they don't like it and you do get slated, well, quite frankly, you're kind of at the end of your career now anyway. You've been doing it for the last 7 years. It's not the end of the world. So, and luckily for me, I've had, massively positive feedback from other psychologists and also some psychiatrists who say, please don't tell anybody that I said this, but I agree with an awful lot of what you say about diagnosis and psychiatric models.
Yeah.
So, and I've also had great feedback from ex-offenders.
Okay.
And people with mental health difficulties, mental distress. So I've actually managed not to piss off any group at all, which I think is how I've managed to do that. I really don't know.
Give it time. We'll see what happens.
Give it time at some point. At some point, I'm sure that I will piss somebody off. And it is a bit of a tightrope. But I've just tried to be honest and fair and real, really. That's all you can be.
Okay. And you mentioned before that you wanted readers to look at the kind of patients that we assess through a less judgmental kind of perspective. In order to aid us do that, are you able to tell the viewers something that they might not expect about the average mentally disordered offender?
I mean, I hate the term mentally disordered offender. I hate the term disordered. And actually, I don't view them as disordered. I view them as having very normal, very human reactions to things that have happened to them. And I think that what I would like to tell people is that mentally disordered people per se, whether offenders or not, are actually not as different from us as we might imagine.
Yeah.
And hopefully that comes through in my books. And I think that might be a bit of a shock to people. People would say to me, well, I really found myself relating to this individual. And actually, had you said to me mentally disordered offender, I would just think crazy axe murderer, somebody that you would cross the street from. You would never want to have anything to do with at all. So I hope that I kind of lessen stigma around it, really. But yeah, they're not so different from you and I. And I would also say that their diagnosis doesn't, I think I've said this anyway, but their diagnosis and their mental health difficulties are not the full story.
Yeah. Lots
of people have mental health problems and they don't become offenders. So it's what I consider a kind of perfect storm of ingredients, if you like, to do with people's circumstances and their personalities, and then mental health symptoms, if that's what you care to call them, mapped on top of that.
Yeah.
That causes extreme behaviours.
So it's really easy to simplify it to say this person's got this disorder and therefore that has these symptoms which control these behaviours, but what you're saying is it's far more complicated than that. There's so many kind of extrinsic
exactly.
factors.
There's no simple why. So
But people want a simple why, don't they? The judges want.
Yeah, not so different to us, and actually, there's always more of a story. There's, and that's why I called the second book "What Lies Buried."
Yeah.
People think that there's literally lots of things that lie buried in the, it's about dead bodies. There is one thing that lies buried in the book, but it's about what lies buried not only in somebody's psyche, but what lies buried in somebody's history.
Yeah.
which has such explanatory power when it's revealed.
Okay. That's absolutely fascinating. And then you mentioned before, Kerry, that in some situations you wonder that if we do more harm than good. I would definitely agree with that. So what came to my mind is that there's certainly some patients that I've seen when I've worked in medium secure units who have just complete untreatable mental illnesses as far as we can tell. So we've thrown everything at them, from attempts at psychology to really high doses of medications, and they just don't seem to get better. And it comes to a point where I've thought to myself, are we actually doing anything for this person, and can we justify locking them up? And I suppose you can to a degree, because the chances are they could be very risky when they're on the outside. So that's the first thing that jumped into my mind. What kind of areas or examples can you think of where you've in your career where you've wondered whether our whole, not you personally, but our whole system is doing more harm than good?
I've been thinking a lot about risk assessment recently, because risk assessment is so central to what we do. And of course, if we get it wrong, then there's a furore, as rightly there should be. But I think that what we do is that we sometimes, I think, inadvertently allow people to believe that our risk assessments are more predictive than they are. And actually, on a lot of occasions, risk assessment results in more false positives.
Yeah.
So risk assessment, by its nature, results in more people being contained or detained or locked up or restricted in some ways than is actually commensurate to their risk. So I think that for people with mental health difficulties, that is particularly true. So, I mean, obviously it's an ongoing, it's an area of science and development, but I think that we need to be honest that actually the whole system is weighted against people that have mental health difficulties.
Yeah.
And we lock far more people up than is actually warranted in terms of public safety.
Yeah.
I don't know what the solution to that is. I really don't know, apart from positive risk taking and really trying to allow people as much freedom as possible. Because you can't necessarily control everything in a person's environment, and you can't control everything that happens to that particular individual or what their circumstances are. But yeah, I often think that we write people off with risk assessments quite often, and I think that when you think about that, that's actually pretty horrifying. Actually,
Yeah.
I think there's an awful lot of people in locked services, because now these days, not only do we have medium secure services and high secure services and low secure services, we've also got locked rehab, which is, nobody really knows what locked rehab is, but it just tends to be a dumping ground for people. And they can stay there for years and years and years.
Yeah.
When I don't know that their risk actually warrants it. And it's a lack of creative risk-taking from professionals, and a lack of social care, really.
Yeah.
People can be supported to have crime-free lives and very safe lives in the community, but there's no money to do that. So that's what I find the most frustrating.
And I think another aspect that is an issue with risk assessments is that they're often misunderstood. The purpose is often misunderstood. So even within professional environments, even within secure units, some people assume that they're about predicting risk. So you're saying definitively that this person has this percent chance or likelihood of committing an offence, but it's not really. It's about understanding the factors that can contribute to this, more painting a picture of where risk can occur potentially, rather than...
Exactly. And I also think that they miss off the end bit of any risk assessment. The end bit of any risk assessment, after you've decided what the scenarios are that somebody is likely to be engaging in risky or dangerous behaviour, then it's risk management. Well, actually, what can we do to prevent this from taking place? And often we'll just say, well, this person is high risk or even moderate risk, and then it ends there. So therefore, we will lock them up. Well, hang on a minute. What are we going to do then to make this, end well? And I think that I learned that when I was working in the community. I was working in halfway houses that were primarily charitable organisations. And people had come out of very, very long prison sentences, and some of them with really quite high risk, and they had to be managed in the community, or they'd come through mental health services and they were being supported, to take that next step to independence. And we really did manage people who you would think would be disastrous. And we managed to make that outcome, positive. So it's just a case of resources. And I think also people viewing offenders as being worthy of these resources. We don't agitate for resources for offenders because most people think, well, quite frankly, lock them up and throw away the key. So we don't have the same pressure on government and policies. Really, all of the pressure that just, come to bear is about being more punitive and putting more rules and restrictions on people.
Yeah, absolutely.
Sometimes it's necessary, but often it's not.
I think you said it yourself. You have to embrace positive risk taking. So something that I'd see time and time again in secure units especially is that patients were not allowed leave because they were aggressive and a bit arsey on the ward, but not dangerous, just a bit cantankerous. But it's kind of chicken and egg situation, because part of the reason that they're like that is because they don't have leave. And sometimes you just got to accept that they might not be that pleasant to you, but that doesn't mean that they can't sort of progress.
And this is it. We don't look at the environment that they're in. I think that if any of us were challenged to go and live in a secure unit for any period of time, it would be very interesting to see what kind of behaviours would, I'm quite anti-authority naturally as a person, and I don't cope well with being cooped up and contained and told, I can't go somewhere or do something. Yeah. So I think that, if I were in that situation, I think I would be a nightmare patient. I really do. I really do. And we say, oh well, that says something about them as an individual. Well, actually, often it tells you something about us as a service. Yeah,
about the system. I agree.
Yeah, and that doesn't mean that some people aren't dangerous, and some people really do need a very close and beady eye on them, because there are those people. But it's about separating those out. And I think that generally we are just far too risk adverse, particularly when it comes to people with mental health difficulties.
Yeah, that's very valid. Okay, so Kerry, my last question for you, and I think you've already touched on this a couple of times throughout this interview, but do you have any views or opinions that might be seen as either atypical or different or controversial within our overall field that you can say without ending your career?
Yeah. Listen, I've said it all in my books anyway. Maybe not all. I've got more to say possibly in the future, but I don't think that I am controversial. I think I'm a growing member of a large community of psychologists who are questioning the systems and asking for an overhaul and radical change in the way that we deal with offenders, the way that we deal with and describe people who are suffering from mental distress. So I don't think that's that controversial. Maybe I'm more controversial in the world of true crime, actually, in having these views. I don't know. I'm kind of like the true crime, anti-true crime person. I don't really know.
Is that because you're pushing towards kind of understanding perpetrators rather than wagging your finger at them? Is that the reason that you might be?
Well, listen. If any of you watch Faking It, the program that I do for Discovery Plus, I do a fair bit of ranting and finger wagging. I'm kind of known for it, to be honest. But yeah, I think it's about being fair and being balanced and nuanced and telling people the truth. This is what I really want to say. I want to see a bit of truth telling rather than sensationalist stereotypes and tropes for the sake of entertainment. It should be more. I believe that the true crime genre should be as much education as it should be entertainment. Really, that's where the sweet spot lies.
Absolutely.
And I guess, and I'm a bit of a social justice warrior. So some people have said I'm far too woke, I'm far too feminist, I'm far too this, that, and the other. But again, I can live with that. I think that I'm very, very lucky. I'm very, very grateful to have a platform that I want to use it for the greater good.
Okay.
Makes me sound like a Miss World contestant, doesn't it?
A very complicated Miss World contestant, yeah.
Yeah.
So Kerry, as we finish, could you tell our viewers where we can find your work and tell us a bit about your social media presence and remind us about your books again, please?
Right. So my books are The Dark Side of the Mind and What Lies Buried, and you can find them in all good bookshops, as they say, and probably a few bad ones as well. You can find me popping up on TV all over the place, really, but particularly on the Discovery Channel and on Discovery Plus. I think that we're now going into our 6th series of Faking It, and you can tweet me at Kerry Daynes, which is pretty simple, really. I'm on Facebook, I think, as Kerry Daynes Psychologist. Haven't got into the Instagram yet. I'm not at that stage of being able to take photos of literally, what I have for lunch. I haven't got the time for that.
Thank you so much for talking to us today, Kerry. It's been an absolute pleasure, and wish you all the best in your many, many endeavours.
Thank you. You too.
All the best. Goodbye.
All right then. Take care. Sorry about the barking. Bye.
Yeah. Oh, yeah. Say goodbye to your dog. I forgot to say that. What was he called again?
Captain Fur Potato.
Captain Fur Potato. Okay.
Burpee for short. Yeah.
Burpee for short. All right. Well, my love to him as well.
Thank you. All
Goodbye.
right then. Thank you. Bye.